Sorry, I had it muted. We're going live in 5, 4, 3, 2.
Calling the Committee on Health and Human Services and the Committee on Commerce and Consumer Protection, 1:00 p.m. agenda. This meeting will also include thereafter the 1:01 p.m. Health and Human Services agenda, and then the 1:02 p.m. Health and Human Services agenda. Present with me are Chair Kehokalole, Member Shimabukuro. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business at 1 p.m. Wednesday, February 14th, room 225, and via video conference. For those on Zoom, your audio will be muted, video disabled until shortly before it's your turn to testify. Each testifier will have 1 minute to testify. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I will be reading, and I also have Vice Chair Aquino. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You'll find a link on the status page for the measure. We appreciate your understanding and remind you that the committee does have your testimony reviewed, so I encourage you to use your time to either add additional comments or you can stand on your written testimony. So first up, SB 3239 relating to medical debt. We have Department, State Health Planning and Development Agency, SHPTA. Dr. Lewin, please stop. Come on up.
Aloha, Chair San Buenaventura, Vice Chair Aquino, and Chair Kehokalole. Thanks for the opportunity to testify. Medical debt is the most common form of personal bankruptcy in the U.S.
Are you standing in support?
In support.
Thank you.
Thank you. Sorry. And all I want to mention is that while this is an important issue to address, other states are working on it, that for the future, we need a universal access system to high quality, equitable, affordable healthcare for all, in which case we won't have medical debt. So let's keep that in mind as our goal in the future, and thank you very much.
Thank you very much. Next, we have Office of Wellness and Resiliency. In support, we have Tia Hartsock. Please proceed. Identify yourself.
Aloha, Tia Hartsock, Executive Director, Office of Wellness and Resilience. We stand in support of this measure. Aloha, Chair, Vice Chair, Senator Kehokalole, and members of the committee. Wanted to make sure that we stand in support, have some comments for amendments, looking at several pieces that we'd like to add to this piece of legislation. It's in my testimony. If you have any questions, please, I'm here to answer questions about our testimony.
Okay, so Ms. Hartsock, I don't have your written testimony, so please provide that. Do you have proposed amendments?
Yes.
Okay, thank you. Okay, and with Chair Kehokalole, we will discuss it. Thank you very much. Next, we have Queens Health System and support. Jason.
Chair will stand for our written testimony and support this program.
Thank you very much. Next, we have Holomua Collaborative. Joshua Wish in support.
I, Chair, will also stand on our testimony.
Thank you very much. Next, we have Adam Zarin, the Leukemia and Lymphoma Society in support. Noreen Cole, Hawaii Children's Action Network speaks on Zoom. Are you present?
Unfortunately, they're unavailable on Zoom, Chair.
Okay, next we have Paige Choi, Healthcare Association of Hawaii on Zoom. I see that she's present. Please proceed.
Hi, thank you so much. Paige Choi with the Healthcare Association of Hawaii. We did submit comments, but I do want to note that our members support the intent, and we as an organization, we are working with the sponsor, and we're following up with the organization nationally that's been really involved in a lot of efforts around forgiving medical debt. And we do plan to meet with that organization to make sure that we are moving forward on this measure and seeing what we can do to ensure access to affordable care for everyone. Thank you.
Okay, thank you very much. Next, we have American Cancer Society Center Action Network in support, Green Party of Hawaii in support, Free Access Coalition in support, RIP Medical Debt Providing Comments, Keith Harrell. Present, no. And then we have a list of a lot of people, all in support. Nicholas Levins, Sandra Capella, Kispin Alice, Susan Staton, Bryson Elegard, Roger Hanson, Teresa Landro, Judy Hepner, Greg Pupioni, Stacy Alapai, Elizabeth Hanson, Sarah Biggs, Shay Hodges, David Lemon, Darnell Guion, Anita Anderson, Dennis O'Shea, Amber Kanehailua, James Hedgehog, John Naylor, Catherine Velasquez, Priscilla Stuckey, Kathy Shimada, Susan Douglas, Terry Yoshinaga, Jackie Keith, Dennis Miller, Junshin, Carolyn Ethan, Brody Lockard, Lisa Silva, Elizabeth Nelson, Lewis Johnson, all in support. Anybody else wishing to testify? Nikos, are you there present on Zoom? You registered? No?
They're not available on Zoom, Chair.
Okay, anybody else wishing to testify? Members, any questions? Okay, seeing none, let's recess for decision-making to read Office of Wellness written testimony. Recess. Recalling the joint hearing on Health, Human Services, and Consumer Protection for decision-making on SB 2119. Chair's recommendation is to pass with amendments. We're just going to add, I'm sorry, wrong one. SB 3239. Sorry. SB 3239. Chair's recommendation is to pass with amendments. We're just going to add a defect date and we put in the language requested by Office of Wellness and Resiliency into the committee report because it did not have the specific wording needed to amend the bill, but basically added its proposed purposes. So as we move this bill along, we are asking Office of Wellness Resiliency for specific language so we can do the amendments appropriately. Any comments, questions, and concerns? Chair's recommendation is to pass with amendments. Chair votes, Vice Chair for the vote, Chair votes aye.
Okay, Senate Bill 3239, recommendation is to pass with amendments. Chair votes aye. Vice Chair votes aye. Senator Keokolole.
Aye.
Senator Shimabukuro.
Aye.
Senator Alwal. Recommendation is adopted, Chair.
So for the joint hearing, CPN.
Thank you for CPN, same recommendation, passing with amendments. Chair votes aye.
Thank you. Vice Chair also votes aye. Senator McKelvey is excused. Senator Richards.
Aye.
Senator Awa.
Aye.
Measure is adopted.
Thank you very much.
Thank you very much. We're moving on to the 101 Health Human Services calendar. And that's basically relating to human services, SB 545, proposed SD1. I recommend inserting the proposed substantive provisions of the Senate draft one and recommit the short bill to the committee for further consideration. Senator Aquino, are you present for the vote? We're just gonna put language into the short form. SB 545, chair votes aye.
Just want to make sure I say the right thing. Okay, Senate Bill 545, Senate Draft 1, passed with amendments, recommitting the bill back to, recommitting the bill back to the committee. Okay. All right, Chair.
Chair votes aye.
Vice Chair votes aye. Okay, everyone is present. Any reservations? Any no's? Recommendation is adopted, Chair.
Thank you. Moving on to the 102 calendar for SB 2119 relating to out-of-state prescriptions. First up, we have Department of Health and Support.
Good afternoon, Chair Santos-Ventura, Vice Chair Aquino. My name is Michael Markham with the Hawaii State Department of Health. We stand on our written testimony and support, and I'm here for any questions. Thank you.
Thank you very much. Next, we have James Kozilski, Board of Pharmacy and Support. I,
Hi.
Sorry if I
Chair, no
mispronounced your
problem.
name.
I'm James Kizuski, Board of Pharmacy Executive Officer, here to stand on our written testimony.
okay, thank you very much. Next, we have Jonathan Ching for Kaiser Permanente in support.
Aloha Chair, Vice Chair, Dr. Department with that and everything.
Okay, thank you very much. Next, we have Walgreens in support. Mihoko Ito or Tiffany Yajima, are you present on Zoom?
They're unavailable on Zoom, Chair.
Okay, and then we have two other people, individuals all in support, Dennis Boyd Miller, and I don't know who the second person is, sorry. Anybody else wishing to testify on SB 2119? Okay, members, any questions? Okay, seeing none, moving on. For SB 2135, relating to Supplemental Nutrition Assistance Program. First up, we have Kathy Betts, Department of Human Services, providing comments.
Good afternoon, Chair, Vice Chair, Jeanette Hayes, Department of Human Services, Benefit Employment and Support Service Division. We stand on our testimony and are available for any questions. Thank you.
Okay, thank you very much. Next, we have Audrey Suga Nakagawa, AARP in support. Thank you very much. Hawaii Appleseed Center for Law and Economic Justice in support.
Hi, Chair, Vice Chairs, member of the committee, Jordan Smith with Hawaii Appleseed, Center for Law and Economic Justice. Thank you for this opportunity to testify in support. We just want to lift up in our testimony that and the comments that DHS has that they don't know how much this cost, and this has come up again and again in the legislature. And so recommending or really asking the committee to consider starting a working group, or maybe altering the bill in that way so we can continue this conversation and have answers ready for the committee next legislative session. Thank you.
Okay, thank you very much. Next, we have Hawaii Public Health Institute in support.
Aloha, Nate Hicks with Hawaii Public Health Institute, chairs, vice chairs, members of the committee. Hawaii Public Health Institute is in support of this bill. Families are faced with a tough decision where if they're earning too little, they're on SNAP and trying to make ends meet. But if they make just over the 200% federal poverty level, they lose all of their benefits. A family of four stands to lose almost or more than $10,000 per year just because they earn an extra $1 or $2 per month. And so people are faced with trying to avoid taking raises, avoid working extra hours to make sure that they hold on to their SNAP benefits. We are discouraging people from improving their lives and pulling themselves out of poverty. We definitely recognize the cost issue. Based on census data, we would expect that beneficiaries, if this program were to be implemented, would be around $50 to $60 million per year. But we understand that cost, not only for this legislative session, but this bill is a big concern. And so we do support the opportunity to delay implementation of this a few years down the line if necessary to figure these data out, or take the opportunity to study the information in a little bit further detail.
Thank you very much.
Mahalo.
Next, we have Hawaii Food Industry Association and support Lauren Zerbel.
Thank you, Chair and committee members. We will stand on our testimony in support of this bill. I concur with what the previous testifier said, that if we need more data on how much this is going to cost, we would love to be a part of that discussion so we can put forward a stronger bill next year. Hawaii is actually about to be subject to a pretty dramatic decrease in SNAP allotment due to the data set being used being limited to urban Honolulu. And this will dramatically impact our lower income residents as well as our business climate. So this bill is necessary for many different reasons. Thank you very much for the opportunity to testify.
Okay, thank you very much. Next, we had Save Medicaid Hawaii and support Hawaii State Coalition Against Domestic Violence and support Aloha United Way and support Malama Kauai and support Catholic Charities Hawaii and support Indivisible Hawaii Healthcare Team and support Hawaii Hunger Action Network in support, Hawaii Food Bank in support, Hawaii Children Action Network speaks in support, Democratic Party of Hawaii in support, Unite Here Local 5 in support, Chamber of Commerce Hawaii in support, Office of Hawaiian Affairs in support, Hawaii Alliance for Progressive Action in support, 18 other individuals all in support. Anybody else wishing to testify on SB 2135? Okay, seeing none. Members, any questions? Okay, so I have a question. Who came up? Hawaii Public Health Institute, come on up. And Appleseed too, you might as well. So it looks like gotta be some kind of working group because you folks can't come up with a reason as to why 15 million versus anything else. So who do you folks suggest should be on the working group?
Off the top of my head, I'm not gonna come up
Have
with a
no idea.
list, but
Okay,
we'll be happy to get back to you on that.
okay. What about Appleseed? Any suggestions? No?
I have suggestions, just don't take it as throwing anyone under the bus, but there are advocate organizations like Appleseed, like Hi-Fi, that are doing this work and conducting this research and really doing that in partnership with folks like the Department of Health, the Department of Human Services, potentially DOTAX, like looking at those entities that might have that information on who that 300% federal poverty line is, who falls into that group.
Okay, thank you very much. Okay, any questions, members? Okay, seeing none, moving on. Next, we have SB 2259 SD1, relating to health. First up, we have DCCA. No, hold on, it's not DCCA. First up, we have HPCA. Hawaii Primary Care Association.
Hi, Eric Gabi. We'll stand on our comments and be available for any questions.
Thank you very much. Next, we have Department of Human Services providing comments. Okay, I see.
Aloha, Chair.
Peterson, please proceed.
Aloha, Chair. Gina Moore Peterson on behalf of DHS, Director Betts. We stand on our written comments and we respectfully request an amendment to delete Part 2, Section 5, since the Medicaid program already provides coverage for these services. Thank you.
Thank you very much. Next, we have DCCA providing comments. Okay, thank you very much. Next, we have Indivisible Hawaii Healthcare Team and support. Okay, next we have 4 other individuals, Doris Matsunaga, Deb Nenman, and Lee. Doris Matsunaga again, twice. All in support. Anybody else wishing to testify on SB 2259 SD1? Members, any questions? I have a question. DCCA. It's your position that, and that's my understanding too, whenever we do a health benefit, we need to have a concurrent resolution for an auditor's report. It's your position that no such auditor report has occurred?
Not that I'm aware of. And so we did reference Hawaii Revised Statute Section 2351, and that before any legislative measure that mandates health insurance coverage for specific health services, specific diseases, or certain providers of healthcare services as a part of individual or group health insurance policies can be considered, there shall be concurrent resolutions passed requesting the auditor to prepare and submit the legislature report.
Okay, thank you very much.
Thank you.
Okay, any other questions, members? Seeing none, moving on. SB 2461 relating to medical cannabis. First up, I see the Attorney General here, not on Zoom, but in person. Please proceed.
Good afternoon, chairs and members. Andrew Goff for the Department of Attorney General. We did submit our written testimony with a suggested amendment, and briefly on the issue that we spotted. The bill would essentially amend HRS section 329D-10, which gives Department of Health the discretion to allow certain medical cannabis products to be sold. And the amendment would basically put a time frame for the Department of Health to implement that, the products that are allowed to be sold as at 9 months. And if at the end of 9 months rules were not implemented, then a dispensary could sell the product without rules as long as they complied with the rest of the chapter. And that inherently conflicts with the rest of the chapter, which requires specific rules on specific products related to testing and packaging and the like. If you have any questions, I'm available for comment.
Okay, thank you very much. Next up, we have Department of Health in opposition.
Good afternoon, chairs, vice chairs, members of the committee. Liam Gimmon from the Office of Medical Cannabis Control and Regulation. We respectfully oppose this measure and stand by our written testimony. We are available for questions if necessary.
Okay, thank you very much. Next, we have Cure Oahu in support. Sanhai Jenna Matilla, are you present on Zoom?
I am,
No?
Chair.
Yes,
Hi.
please
I'm
proceed.
sorry. Aloha Chair, Vice Chair, members of the committee, Jenna Matilla on behalf of Cure Oahu, and we are going to stand on our testimony in support of this bill and would just like to note that there is no desire to subvert safety or quality product standards. We are simply looking to move forward with dispensary to dispensary wholesale and promulgation of rules in a timely manner. And we respectfully ask that you pass this measure so that we can continue this discussion. And we appreciate the opportunity to submit testimony.
Okay, thank you very much. Next, we have 2461. Hawaii Cannabis Industry Association in support. I see Tai Cheng.
Chair. Thank you, Chair, Vice Chair, and members of the committee. My name is Tai Cheng on behalf of the Hawaii Cannabis Industry Association. I showed up today instead of being on Zoom. Thank you for taking me in person. We support this bill. It's a measure to try to get the Department of Health to move forward on promulgating rules after the legislature has already passed laws on wholesale as well as what products are allowed. I've provided to your counterparts in the House similar health committee, 5 jurisdictions that have medical only programs, which allow for pre-roll products that were approved by the legislators 2 years ago. But the Department of Health has decided to take its time when coming up with rules by picking and choosing which rules it would like to put forward, even though laws have been written otherwise. I'm available for any questions. Thank you very much.
Okay, thank you very much. Next, we have Clifton Otto, Akamai Cannabis Consulting, providing comments on Zoom. Dr. Otto, you're present. Okay.
Yes, I'm here.
Okay, please proceed. You have 1 minute.
Thank you. Good afternoon, Chair, Vice Chair, members of the committee. Dr. Clifton Otto, you have my written testimony providing comments. I got a few brief remarks. This bill, by simply changing the word may to shall, would remove the department's discretion over rulemaking for dispensary wholesaling, which I believe is ill-advised. The department needs to maintain discretion over wholesale rulemaking because the jurisdictional limits of the state do not connect all the Hawaiian Islands, which means that the department needs to assess its risk for participating in the violation of interstate commerce on a case-by-case basis. In a similar fashion, an existing provision in this bill requires that the department adopt rules for the sale of pre-rolled marijuana cigarettes or pre-rolls, which are meant to be smoked. The department should not be forced to adopt rules that go against the mission to protect public health, especially when there are safer ways to inhale cannabis. I have provided suggestions for amendments in my written testimony, which I hope you will adopt. Thank you very much, and I will be available for any questions.
Okay, thank you very much. Nobody else having registered. Anybody else wishing to testify on SB 2461? Okay, you have 1 minute, Angela.
Angela Melody Young, testifying on behalf of CARES, Aloha Chair, Vice Chair, and the committee. Marijuana is an illegal Schedule I substance on the Federal Controlled Substance Act as declared by the DEA, the Federal Department of Health and Human Services, and the Federal AG. Okay, I went over this last season. I'll go over it again. And Schedule I is the most dangerous drug, such as MDMA, marijuana, and magic mushrooms. The reason is because these drugs have the highest potential of abuse and no known medical value as declared by the federal government. The Hawaii's Uniform Controlled Substance Act and the Hawaii Revised Statute 329 reflects the federal act with some exemptions. And because of the state exemptions, marijuana is legal for medical use. So The thing is, with this measure, we are in strong support because only if you have credible evidence through medical clinical trials and studies that it is medically beneficial and helps a lot of people, you can submit it to the federal HHS for approval and unschedule it from Schedule 1. That is a proper procedure. Until that happens, I testify for more statutory provisions to protect the people of Hawaii. Thank you.
Thank you very much. Anybody else wishing to testify on SB 2461? Members, any questions?
Yeah, I have a question for Department of Health. Can you respond to Mr. Cheng's testimony? It's my understanding that he is not alone in the feeling that the dispensary industry viewed legislation that we've passed in these chambers that have been enacted into law that that appear to be they appear to summon that community that the Department of Health is exceeding their discretion and either going slow or refusing to implement some of those provisions like pre-rolls.
Yes, thank you, sir. We're not refusing to do it. We just want to make sure that we follow the best rules, regulations, and standards for these products to come through. We also have to prioritize what we are doing in our office. We are a small office. We have one office assistant, 5 surveyors, and a supervisor. We are tasked with monitoring, inspecting all 37 medical cannabis facilities. We inspect and monitor all production, manufacture, testing, labeling, packaging of all medical products. We inspect and the laboratories, monitor the lab testing. We monitor and track all the products. We also have to investigate and respond to all patient complaints and all adverse reactions. That being said, we also have to deal with the rule revisions and changes. We've had 4 revisions in the last 2 years, including the last one for Act 108, which the pre-rolls were part of. We had to prioritize our actions to try to get the most bang for our buck, so to say, to try to get the best products out there in a timely manner that we knew were safe and that we could back with the backing of the Department of Health. We did push to have the dispensary sales done because our licensees had requested us to do that. So we put the majority of our forces towards figuring out how that was. We also doubled the number of signs we're allowed. We allow maintenance people in without being checked, record checked, things like that. So we really had to prioritize what was going on. We knew that the pre-rolls would slow this process down. So we want to get the first parts of Act 108 out there. We did get it out. We got it out within 2 weeks from when it was signed, which I think is very amazing. On top of that, we've also have been handed the regulation of hemp, cannabinoid hemp products. We took that on in May of 2023. And that time we also have to develop revised rules for that whole process for 1137 HAR and 328G HRS. And we have been working on that to try to get that out. We've also had to change the application process for hemp processors. We had to develop an application, get it approved and get it out. We also had to work on getting a definition for our the hemp crude products so we could get that out so our hemp farmers and processors could actually do something. What I'm trying to say is that my office is small. We have to prioritize what we're doing to try to get the best rules out there, the safest rules. We have to prioritize the health and safety of our patients and the public in Hawaii. And sometimes I understand the licensees and our priorities do not line up, and I understand that, but we do have to fall back on our goals as the Department of Health and our mission, which is to protect the health and safety of the patients and the public of Hawaii.
Any other questions? Okay, I have a question for the AG.
Oh, thank you.
Okay, so basically, your main testimony is the automatic allowance in the event that there isn't any rules. However, if you look at the bill already, the bill merely allows for the transfer of those cannabis products that have already gone through testing.
So there are 2 aspects to the bill. The first is regarding the dispensary to dispensary transportation. And then the second, which I think is around page 5, speaks to 329D-10, which is implementing the products themselves.
Okay, but as far as the transportation itself and the sale between dispensaries of products that have already been tested, I don't see that as affecting the health and welfare of the community, where we have already required them to go through seed to sale testing and require that each product that to be sold to already be tested.
Yeah,
I mean, help me out here. How could these products, which we have already super regulated, except now we're just allowing them to be able to sell amongst each other, products that are already tested? How is that in any way affecting health and welfare of the community?
I mean, I'm just speaking to the legal inconsistencies in the
Well,
bill
maybe
itself.
Department of Health can tell. How can products that have already gone through testing
Yes, ma'am.
be in any way? I mean, they've already been tested, because that's what the bill says. If they've already been tested, shouldn't they already be allowed to be sold between dispensaries if
Correct.
they can sell it to patients?
Yes, ma'am. They actually are allowed to sell between dispensaries, and there is inter-island sales between our licensees. We've had 9 sales
Then why-
between licensees. We just think that it is an emergency proposal that you should either, if it is an emergency, one of your grow rooms burns down, you have a problem, you lose a whole crop, that if you need to refill your stock, that is an emergency, so you could get that right away, handily.
Okay.
If not, we allow it also to have dispensary sales within 30 days.
So, thank you. So Tai Chen, come on up. So you heard Department of Health, they're saying that there was already regs that allow you to do this. So why do we need this bill?
This bill holds the Department of Health responsible for the laws that have been passed by the legislature. What the Department of Health has failed to testify today, but has testified in a previous hearing, is that the main reason why pre-rolls are not allowed and were not included in the rule package was the Department of Health's anti-smoking feelings that they have within the department. One other provision within 1082 that was left out in rules was also to allow for a helper or caregiver or family member to escort a handicapped patient or someone that's unable to enter the dispensary to wait in the lobby, not even in the.
Okay, that's not in this bill though. That's
No,
another
but
bill.
this
You
is.
can't testify to any other
Sorry,
bill,
but this
okay?
is a
Let's
way
get
to
into
push.
this one.
So the timeline, the 9-month period that the Attorney General is referring to does force the department's hand in requiring them to come up with rules within that time period, or else it
Okay.
defaults back. So
Thank you, Tom.
I can understand why they would not want that provision.
Any other questions, members? Okay, moving on. SB 2992, relating to mental health. First up, Hawaii State Department of Health and Support. I'm sorry, is it 2992 or 2885? I'm sorry, 2885. Sorry, I jumped the gun. SB 2885 relating to homelessness. First up, Hawaii State Department of Health and Support.
Good afternoon, Chair and Vice Chair and members of the committee. John Valera with the Alcohol and Drug Abuse Division, testifying in support. We also would like to continue the conversation with our providers to ensure that, see exactly what kinds of triage services. So I'll be checking with as well as withdrawal management services, also known as detox, are needed in the community. And so we'll be working with our mental health divisions.
Okay, thank you very much.
Thank you.
Next, Office of Homelessness and Housing Solutions and Support, Institute of Human Services and Support. Please come on up.
Aloha, Chair, Vice Chair, and committee members. I'm Angie Knight with Institute for Human Services. We stand in strong support of this bill with the amendments that are in our testimony. We would like to request that the management of the homeless triage centers be moved to Department of Health under ADAD as previously testified. Additional to that, we wanted to specify the difference between a behavioral crisis center and a triage center. Behavioral crisis centers are not voluntary. That's where the HPD and other emergency services bring individuals who are under an MH order, and a triage center is voluntary. So that's when individuals who are seeking either withdrawal management or detox and psych stabilization voluntarily decide to come to receive services. Thank you so much.
Okay, thank you very much. Next, we have Partners in Care, Oahu's Continuum of Care. Laura Thielen, are you present on Zoom?
They're unavailable on Zoom, Chair.
Okay, Hawaii Substance Abuse Coalition and support, Shauna Kukila in support. Shauna, please proceed. You have 1 minute.
Chair and committee members, I stand on my written testimony that we need these triage centers immediately, and remind you of the 2 births given out on the streets. 2 women had, on 2 different islands, had given birth to infants on the street, and people need triage somewhere to help them. We needed this in every county, and we also, I feel that OHA, the VA, needs to partner with the state to get their constituents off the street, those who depend on Veterans Services or the Office of Hawaiian Affairs, who has a duty of care for these people. So I also urge you to use the terms endangered, vulnerable, and unsheltered in all of these homeless legislations. Thank you.
Okay, thank you very much. Okay, next we have 2 other individuals all in support. Members, any questions or anybody wishing to testify? Come on up, Angela.
Angela Melody Young, testifying on behalf of CARES. Actually, no, Kapalama Neighborhood Security Watch, because this is a safety issue. So homelessness is a policy concern, a humanitarian concern, and it is also a medical and public safety concern. The medical and public safety aspect is what people tend to overlook. The federal HUD defines chronically homeless as an unsheltered person with debilitating medical conditions, such as substance abuse, drug addiction, alcoholism. These are medical concerns, and it debilitates them. And then they have to get benefits, welfare, housing, transitional housing, and they have to go to triage. It's also something of a public safety issue because as a volunteer safety coordinator, we have to witness a lot of these things. And so what we're here to advocate today for is that the root of homelessness is medical. So we should be supportive of triage and the
thank you, Angela,
institutionalizing
appreciate
of the homeless. Thank you.
Thank you. Anybody else wishing to testify on SB 2885? Seeing none, members, any questions? Department of Health, I have a question. Since you're here to testify. Senator Keoho Kolole and myself went to go see the Evile Center, and my understanding is that is a proof of concept of a behavioral health treatment center. You heard IHS say that that is involuntary, but that wasn't my understanding when we viewed it. Is it? What I want to know is the difference between the triage. I see Dr. Mizuo. So.
Hi, Courtney Matsu, Medical Director.
Sorry.
Acting Administrator for Adult Mental Health Division. So the BHCC, or the Behavioral Health Crisis Center, is both involuntary and voluntary.
Involuntary. That's my understanding too. It's both. Okay, thank you very much. Okay, anybody else wishing to testify? Members, any questions? Okay, moving on, SB 2992 regarding relating to mental health. Okay. The Hawaii State Department of Health in support of 2992. Okay, Dr. Matsuo.
Courtney Matsu, Medical Director.
I apologize. I keep screwing up your name. Sorry.
MHD. Hi, thank you. The department stands in written support for this bill. We did add an amendment to request appropriation for consultation to get expert opinion on federal statutes and mental health laws throughout the country.
Okay, thank you very
Thank
much.
you.
Next, we have Hawaii Health Systems Corporation in support. Next, we have Queens Health System providing comments. JC,
We'll support, Chair, just asking to be added on to the committee. Thank you.
I see that. Okay, two other individuals providing testimony in support. Anybody else wishing to testify on SB 2992?
Senator Malia Smith at HHS-C, we did also ask for an amendment to be included as well.
Yes, I saw that too. Thank you. Okay, anybody else wishing to testify? Shauna Kokila, SB 2992, please proceed.
Chair and committee members, thank you for the opportunity to testify. My name is Shauna Kokila. I'm in from Hilo. Just wanted to request that you look at this bill and some of the things that it calls for. One of the things is every 10 years, it will reconvene the Advisory Committee on Mental Health to review the codes. And I think it should be 5 years, just because there's so many things that happen within that time. I think that 10 years is too long. And then also it should include those who have suffered from mental health issues and have tried to navigate the system themselves, such as individuals and their family members. So if you could add those people in, it would be very effective. Thank you.
Okay, thank you very much. Next, for anybody else wishing to testify on SB 2992? Okay, members, any questions? So I have a question of Dr. Matsu. Okay, seems to me, do you have any objections to my removing the Director of Department of Health as chair and substituting the Governor's advisor on mental health and the judiciary? I don't want to give you an appropriation.
Okay.
So you're good with that if there's no appropriation?
I believe so. We'd have to look at the members of the committee to ensure that we get
the Department of Health still
review.
remains as a member. If you look at the work, if you look at the advisory committee, Department of Health still remains as a member, but not as chair.
I'd have to have further discussions on that.
I figured that.
Yeah.
Okay, thank you.
Thank you.
Okay, any other questions? Seeing none, moving on. SB 3001 relating to autism. DCAB, Kirby Shaw in support. Next, we have Department of Human Services, State of Hawaii providing comments. You present, DHS?
Yes. Aloha, Chair, members of the committee, Judah Moore Peterson, on behalf of DHS and Director Betts. We stand on our written comments. We appreciate the intent of the bill as long as it does not reduce or replace the priorities identified in the governor's budget. Thank you very much.
Okay, thank you very much. Next, we have Bayada in support.
Good afternoon, Chair, Vice Chair, and members of the committee. My name is Jocelyn Miller on behalf of Beata. We stand on our written testimony in support of increased Medicaid bill rates. Current bill rates do not allow agencies to effectively service our Quest families and children. We respectfully request the committee pass this bill in support of increasing rates for what we believe are undercovered behavioral health services. Thank you.
Thank you very much. Next, we have Hawaii Association for Behavioral Analysis in support. Are you present? Please identify yourself.
Thank you, Chair, Vice Chair, members of the committee. Kristen Copa-Burt on behalf of the Hawaii Association for Behavior Analysis. We stand in strong support and will stand on our written testimony. Just calling attention to, we are a nonprofit volunteer association that represents providers and consumers of our services. And I think you'll see reflected in the written testimony, really the urgent need for increasing our rates so that we can provide the needed services for children with autism, particularly on the neighbor islands. We are seeing a really difficult time for providers, with providers closing, many people resigning, not being able to find housing, and really just looking to meet the need to ensure that we can see Quest members and children that need access to care. Thank you so much.
Okay, thank you very much. Next, we have BTSH and support Fred Ewan. Okay, we have JC Fernandez, Behavior Analysis No Ka'oi in support. Hawaii Disability Rights Center in support. Hawaii Early Intervention Coordinating Council in support. Mauloa Learning LLC in support. Anna Zielinski, BCDA in support. Early Childhood Action Strategy in support. Horizons Academy of Maui in support. Maui Learning Academy in support. Behavior Analysis No Ka'oi in support. Jocelyn Miller in support. Jocelyn? Okay, you already testified for Bayada. Okay, and Shana Kokila is on Zoom. Are you in support?
I am in full support, Chair and members. Thank you. I'm going to stand on my testimony and also to say, as a mother of an autistic child, I really know that from experience, we are lacking highly qualified applied behavior analysis. Anybody can be an ABA, but you want them to be highly qualified because they need to know a lot more than just the basics. It would help to have more. And just to back up my testimony, the Department of Human Services, Child Welfare Services has 0 ABAs. And that is a problem for children in the foster care system. So that needs to be addressed right away. And I would encourage the legislature to look into that. Thank you.
Okay, thank you very much. There are 53 other individuals in support. Anybody else wishing to testify? Angela, please proceed. You have 1 minute.
Angela Melody Young, testifying on behalf of CARES. Aloha, Chair, Vice Chair, and the committee. Behavior analysis is a science that studies the behavior of human and non-human organisms. The focus of this science is to understand, explain, describe, and predict behavior. The field may be split into 2 aspects of scientific endeavor, as well as an associated technology for changing behavior for practical purposes. Applied behavior analysis, also called behavioral engineering, is a psychological intervention which applies approaches based upon the principles of respondent and operant conditioning to influence the behavior of the social situation. So basically what this is saying is that we need behavior analysis to predict behavior patterns of those who suffer from autism as children. And this healthcare level is so superior in support of it. To help autism, this proposal is to upgrade the level of care of behavior health analysis so that they can grow up with healthcare and we can have a society of functioning,
Angela.
healthy human beings. Thank you.
Thank you. Anybody else wishing to testify on SB 3001? Seeing none, members, any questions? Seeing none, do we need to recess for decision making? Nope, we're good. Okay, for decision making. First up, SB 2119. Relating to out-of-state prescriptions, Chair's recommendation is to pass as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Chair votes aye.
Okay, thank you very much. Recommendation of the chairs to move Senate Bill 2119 unamended. Okay, Chair votes aye. Vice Chair votes aye. Senator Keokolole.
Aye.
Senator Shimokuro.
Aye.
Senator Awa. Aye. Recommendation is adopted.
Okay, for SB 2135, Chair is super sympathetic to the advocates, but we don't have enough information. And we don't even have enough information as to who to put in a working group. So we're gonna allow the advocates to keep working on this during the interim, come back to us. And I want the advocates to also look at the bills we have already passed, like the Double Bucks program to support, to increase SNAP benefits. And otherwise, we're going to defer this. So for SB 2259 SD1. So the last one we're deferring, yeah, 2135. For SB 2259 SD1, Chair's recommendation is to pass with amendments. We are going to remove Part 2 because 2020 session, we passed already the Medicaid coverage of dental bill. So we agree with DHS that MedQuest is already covering what is requested here. And we also agree that there needs to be an auditor's report. So we are gonna amend Part 1 in its entirety to require for SMA to put in language requiring an auditor's report for what is requested. And we're gonna put in a defect date because I don't know whether or not the advocate has put in a resolution for the auditor's report as required by statute. So defect dated to December 31, 2050. Passed with amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, thank you very much. For SB 2461, there is a question as to whether or not this is necessary. So we're gonna keep it alive, however, by passing it with amendments. We're gonna accept the Attorney General's proposed amendments. Any comments, questions, and put in the defect date of December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 2885, Chair's recommendation is to pass this with amendments. We are going to remove its content and put in a working group. The co-chairs of the working group would be the Governor's Senior Advisor for Mental Health and Justice System and the Governor's Coordinator of Homelessness. The members are going to be 2 members appointed by Senate President and House Speaker, a member of the Judiciary, a member of the Department of Human Services, a member of the Department of Health, a member of the Partners in Care Continuum of Care group, and also a member of Bridging the Gap, the Neighbor Island Continuum of Care. Any comments, questions, concerns? And the reason for the working group is we want a coordinated system of how we handle homelessness and those who are behaviorally health challenged. And having a Department of Health system and a Department of Human Services system, triage, as well as the judiciary system on how they do diversion is counterproductive because we don't know where we are funding what. So we're hoping that the Governor's Senior Advisor for Mental Health and Justice System and the Governor's Coordinator of Homelessness, whose job it is to do the coordination, can give us a pathway forward. So that's passed with amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 2992, Chair's recommendation is to pass this with amendments. I see the need for a mental health penal code review, having been involved in the 704 system as an attorney and as such, Chair's recommendation is to pass this with amendments. We are going to substitute the Director of Health with the Senior Advisor for Mental Health and the Justice System and the Governor's Coordinator of Homelessness as co-chairs of this advisory committee. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
SB 3001. Chair is going to pass this with a defect date. I am going to commend Judy Moore Peterson for providing us with the different scenarios as to cost consideration to help those who are helping those in the autism community. This is going to be a tight appropriation year as we are being told in the legislature, but I want the conversation to continue. So we are going to pass this with the blank appropriation, which hopefully some kind of funding will be allowed, otherwise as is. Any comments, questions, concerns? And we're going to put in the committee report all the proposed scenarios that DHS has provided regarding rates of pay on how we could increase those who help those who are autistic. Okay, pass with amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, nothing else. We are adjourned. Thank you, folks, until 3 o'clock.